one, and it's very heartening to see so many people joining us for this event. And it's indeed a great privilege and honor to have Dr. Zhao with us today to share his experience with dealing with the COVID-19 virus in China. So Dr. Zhao Lei is a professor of medicine and a chief physician at the Department of Infectious Diseases, Wuhan Union Hospital, Tongji Medical College, Huazhong University of Science and Technology. Dr. Zhao has also completed postdoctoral training at Massachusetts General Hospital, Harvard Medical School, and since the COVID-19 outbreak, he has been working tirelessly on the front line, and he has personally treated more than 100 patients. So Dr. Zhao also has met with doctors from many other countries and online, including doctors from Italy, Poland, Brazil, the US, and etc., to discuss his experience in treatment and prevention of COVID-19. And so I'll just turn the event to Dr. Zhao. So let us warmly welcome Dr. Zhao, even though we cannot hear the applause, but yeah. Thank you very much. Yeah, here is Dr. Zhao. Yeah.
Good evening, Mr. Wu and Ms. Wang, and good evening, friends in the University of Utah. I'm glad to introduce my experience to fight the COVID-19 in Wuhan. Let me show my PPT, and I will explain what happened and what we have done in Wuhan to how to fight the COVID-19. Okay, so today we will discuss and communicate my experience of fighting COVID-19 in Wuhan. At first, I will introduce the Wuhan city for you, and this picture is the sightseeing in the Wuhan city, and in the middle area of the picture, that's the Yangtze River, and the city is laid along the Yangtze River, and it's a very, very big city. That's the map of China, and Wuhan is capital of the Hubei province in central China. It's the largest city in central China, and almost the top 10 mag cities nationwide. You can see in the map, Wuhan is belonging the heart of the China, and to Beijing, Shanghai, and Guangzhou, and the other main cities within 4 hours. 4 hours. So it has long been an economic, industrial, and transportation hub for both the region and all over the country. Wuhan is also the scientific, cultural, and educational center of central China. With his strengths in this regard, ranking is the 3rd among the China cities, behind Beijing and Shanghai. Wuhan boasts abundant intellectual and human resources. There is more than 50 institutions of higher learning with more than 700,000 students. Together with the key universities such as Wuhan University and Huazhong University of Science and Technology. My hospital is also affiliated in the Huazhong University of Science and Technology. It is recognized as the political, economic, financial, cultural, educational, and transportation center of Central China. So next, I will introduce some of the pictures in the pandemic in Wuhan. The pictures is also in the public, most from the China Daily and Xinhuanet. The first picture is the yellow crane tower is being shooted at the January 24. You can see that the January 23 Wuhan was locked down. So the next day, the photojournalist take this picture, and this road is the main traffic road in Wuhan. But at that day, is almost no vehicles on the road. So it is the very is a lockdown Wuhan picture. I think it's very different from the normal days. This picture is a resident rides past the closed Huangpu Road metro station in Wuhan. It's taken at 25 January. So you can see that the all of the subway were closed, and in the lockdown duration, every person cannot be take subway, and all the public traffic was blocked. This picture is the expressway in the city. Just you can see the night traffic, and just no almost you can hardly see the vehicles on the road, and is taken from the January 26. This road is also a heavy traffic in the normal days. That's the picture is the tunnel just crossing the Yangtze River. Wuhan was divided to 3 towns.
So it looks like Dr. Zhao might have some internet issue. Let me just quickly check in with him.
It's okay.
It's still a little.
Okay, so this picture is the Yangtze River tunnel.
Sorry, we lost you again.
It's okay.
Now seems fine. Do you mind jumping back in maybe? I think your video also froze. Sorry about that.
Okay, so
So the video seems fine. Yeah.
okay.
Yeah,
So,
I think it's better now.
Okay.
Okay.
So let's continue. This picture is the tunnel entrance in crossing the Yangtze River, and the tunnel is most heavy traffic in the city in the common days. So at the January 28, this picture was taken, and you can see the tunnel and no vehicle can be enter into the tunnel, and as well known, the Wuhan city was divided by the Yangtze River and the Han River into 3 towns. The city was connected by the many bridges and tunnels. So normal days, we just cross the one town to the other town by the Yangtze River bridges and Yangtze River tunnels. So okay, so this picture is taken from the community. A community in Jiang'an district in Wuhan is the upper of the picture is the celebration of the Spring Festival, and the lower of the picture is a board that notice that the forbidding the entry of cars from outside of the neighborhood. So just taken at January 28, and the community was locked down. And this picture is taxi drivers waiting besides their cars on January 28. Local authorities in Wuhan have designated more than 6,000 taxis to drive food and communities to residents in downtown area. And not only the 6,000 taxis and the other more than hundreds and thousands of the volunteer also deliver the food and commodities to the residents in the lockdown communities. And this picture is taken from the gate of the community. Bags of the free vegetables are ready to be picked up at a resident community in Tangjiadun Street in Wuhan in March 5. And in that time, the community was blocked and the residents can be allowed to walk to the gate of the
Dr. Zhao, I think we're having trouble hearing you
and
again.
volunteer taken to the community and just.
Can you hear me okay?
It's okay now?
Yeah, it was just
I can hear you.
Yeah, it was very sporadic. So right now it's good. And sometimes there's might be like a 10 seconds that is not doing well. It seems good now. Thank you.
Okay. So I think
I think it's not
stable.
working very well
now. Okay.
Is it
so this picture is at the time here fruits and.
Sorry, can you hear me? There's a lag, I think. Hello, Dr. Zhao, can you hear me?
Sorry. I can hear you.
I was wondering if you can.
No, I can.
Yeah, so I can share this. I can share the slides. I was wondering if you can dial in on your phone, so that might be easier. I wonder.
Maybe the internet is blocked.
Yeah, the internet is not very stable. Like it's good for a second and then not good for another second.
So
do you happen to have a different Wi-Fi nearby that you can use?
Oh, okay. Just I change your Wi-Fi. Okay. So just wait a minute.
Okay, thank you. Sorry about that. Thank you all for your patience.
It's okay. Can you hear me?
Yeah, it seems fine now.
Okay.
Yeah, do you mind turning off your camera? I think that would help.
Okay. I just turn on the camera. Can you hear the slides?
Yes.
Okay. Okay. So we will continue, and I will introduce this picture for everyone, and in the picture there's many bags of the free vegetables, and this is the resident, and she or he will be ready to pick up the vegetables. And okay, so at that time, volunteers delivered the free food and communities to the gate of the community, and the resident would be allowed to the gate and taken their food, the food or communities they need into their home. So this picture is taken from the Wuhan reopen. That it is the day was the April 13. This picture is the Yangtze River, and the city is lay around along the Yangtze River, and just is a beautiful city, and all nights is on, and all the buildings and is night up. So just it taken at the April 13. So it's a light view. It's just it can be seen that Wuhan was recovered from the pandemic of the COVID-19. This picture was taken at the International Labor Day at the May 4th, and you can see that the cyclists and pedestrians traversed the bridge at East Lake on Sunday in Wuhan. That's the after the hardest hit region from the COVID-19 pandemic, and locals enjoying in their first public holiday since month-long region lockdown was lifted. And you can see that's the bridge, and the many persons were walking and riding free across the street, the bridge and the street. And at the June, people go shopping at a night market on the street of Wuhan. It can be seen that in the June and after that day, Wuhan the economy was recovered, and you can see that the peoples were wear the masks, and but they walk and shopping free, just like the normal days. So next, I will introduce some data and some action in the fighting COVID-19 in Wuhan. In the literatures, I will find some materials. The COVID-19 global pandemic is the most extensive to afflict humanity in a century, a serious crisis for the entire world, and daunting challenging, it poses a grave threat to human life and health. In China, as at the end of the May 31st, cumulative total of more than 18,000 confirmed cases had been reported on the Chinese mainland, and more than 8,000 infected had been cured and discharged from the hospitals, and more than 4,000 people had died. This demonstrated the cure rate of the more than just about the 94.3% and a fatality rate of 5.6%. So this figure is the daily figures for newly confirmed cases on the Chinese mainland. Just for the February 12th, newly confirmed cases reached more than 10,000, including the 13,000 cumulative clinical diagnosis case in Hubei. So just so we can see at the end of the February and early March, the cases was smaller and smaller. So just from the fighting COVID-19 China in action, I will introduce some points. At the 2019 December 27, Hubei Provincial Hospital of Integrated Chinese and Western Medicine reported a case of pneumonia of unknown caused to the Wuhan Jianghan Center for Disease and Prevention and Control. That's the first the report of the pneumonia of unknown. Just is the first report for the COVID-19 in China. The two pictures is the hospital. That's the Hubei Provincial Hospital of Integrated Chinese and Western Medicine. In January 1st, the National Health Council, the NHC, set up a leading group on the disease response. On January 4th, the head of the China CDC held a telephone conversation with the director of the US CDC, briefing him about the new pneumonia. And at January 5th, China sent a situation update to the WHO. The WHO released the first briefing on case of pneumonia of unknown cause in Wuhan. The picture is the WHO website, and they released pneumonia of unknown cause in China. And at the January 7th, China CDC succeeded in isolating the first novel coronavirus strain. And this image is from the China CDC website, and is the first picture taken from the virus in the microscope. And at January 8th, expert evaluation team designated by the NHC initially identified the new coronavirus as the cause of the disease. The head
Hello, Dr. Zhao. I think we lost you again. Dr. Zhao, can you hear me? I'll send him a quick message. Dr. Zhao, are you still there? I see you're trying to share the screen, but we're not seeing anything. We also couldn't hear you. Okay, I'll try to give him a phone call. Okay, he's gonna rejoin us again. I was just on a phone call with him. Sorry about the internet connection. It's just kind of unpredictable. And thank you all for your patience. I think we can hear you now. Can you say something?
Okay.
Yes. Seems good now.
Can you hear me?
Yes.
Okay, so
Yeah. So yeah, I think since we had a lot of technical interruption, maybe we can kind of jump ahead a little bit, just for the sake of time, if you don't mind.
so it's okay now?
Yeah.
Okay. Okay. Let me continue. And at the January 8th, an expert evaluation team designated by the NHC initially identified the new coronavirus as the cause of the disease. The head of the China and the US CDC held a telephone discussion on technical exchanges and cooperation. January 9th, China informed the WHO of development and initial progress that had been made in determining the cause of the virus pneumonia. The WHO released on its website a statement regarding a cluster of pneumonia cases in Wuhan. At January 15th, the NHC unveiled the first version of a diagnosis and treatment protocol for novel coronavirus pneumonia, and the protocols on prevention and control of novel coronavirus pneumonia. At January 20th, the NHC held a press conference for the high-level expert team, at which it was confirmed that the virus could transmit from human to human. So at that day, the virus and the disease was confirmed by the China CDC and the China NHC. And at the January 20, the NHC made a statement on implementing the above state council decision and bringing the pneumonia and quarantinable infectious disease management in accordance with the frontier health and quarantine law of the People's Republic of China. That's the picture is the release of the NHC. And at January 23rd, around 2 a.m., Wuhan City Novel Coronavirus Prevention and Control Command Center issued a number one public notice declaring the temporary closure of the city's outbound route at its airport and railway station at 10 a.m. The same day. The picture is the left picture is the subway and the railway station. At the railway station, it could be seen the low person in the station, and the right picture is showing the expressway to the airport, and the road, the express, the way is was also blocked at that day at the 10 a.m. At January 24th, dispatch of national medical teams to Hubei and Wuhan began. In the ensuing period, a total of 346 medical team composed of 42,600 medical workers and 965 public health workers from across the country, and the armed forces were dispatched. The two pictures showing the medical teams is just was entering into Wuhan at that time. At January 30, the NHC notified the US through the official channel that American experts was welcome to join WHO China joint mission on coronavirus disease. The US replied and expressed his appreciation on the same day. On February 2nd, under the guidance of the Central Steering Group, Wuhan began to adopt measures to put four categories of people. The four categories including confirmed cases, suspected cases, febrile patients who might be carriers, and close contact, and classified management in designated facilities. So it's the four sorts of the people was divided in different areas. At February 3rd, the Central Steering Group sent to Wuhan 22 national emergency medical teams from all over the country, all over the China, and gave the order to construct the temporary treatment centers, most of the Fangchang hospital or the makeshift hospital. After that, the pandemic of COVID-19 in Wuhan is controlled in about half a month. At February 18th, nationwide, the daily number of newly cured and discharged coronavirus patients exceeded that of newly confirmed cases, and the number of the confirmed cases began to drop. The NHC sent a reply to the US HHS on further arrangement concerning bilateral health and antivirus cooperation. At February 19th, for the first time in Wuhan, newly cured and discharged cases outnumbered newly confirmed ones. So after the emergency treatment in Wuhan, the pandemic would be controlled about half month. And at March 6th, the daily increase in the number of domestic cases on the Chinese mainland dropped below 100 and fell further to a single digit on March 11th. On March 18th, for the first time, no new domestic cases were confirmed on the Chinese mainland. And at April 8th, Wuhan lifted its 76-day outbound traffic restrictions, and the local work and daily life began to return to normal. The picture is they take the block and the expressway was reopened. At April 26th, the last hospitalized COVID-19 patient in Wuhan was discharged, and at the that news in Xinhua, they reported that event. So in the experience of the fighting COVID-19 in Wuhan, I will share some highlights on that the fighting progress. The first is the early detection, reporting, quarantine, and treatment with a focus on the four categories of vulnerable people, including confirmed cases, suspected cases, febrile patients who might be carrier, and close contact. Is the very important method to control the disease. The second is while keeping all its outbound routes closed, Wuhan carried out 2 rounds of the community-based massive screening of its 4.21 million households, leaving no person or household unchecked and ruling out all potential source of infection. And 2 hospitals in 1,000 plus beds each, Hosenshan and Leisenshan hospitals were built as specialist hospitals for treating infectious disease. And a number of designated and general hospital were expanded or remodeled. The number of the beds for severe cases quickly increased from around 100. That's the 2 pictures of the Hosenshan and the Leisenshan hospital. Was emergency be built up into some days. And the 4th point is in Wuhan, faced with surging infection and considering that 80% of the cases were mild, the city government mobilized resources to repurpose stadium and the exhibition center into 16 temporary treatment centers with some 14,000 beds. This center were able to admit or confirm the mild cases for treatment. That the 2 pictures is the it taken from in the stadium, just called as Fangchang Hospital. And the 5th is the leveraging the unique strengths of the traditional Chinese medicine and providing free treatment for patients. So an article in the Lancet wrote, to relieve the huge press on the healthcare system, Fangchang Child Hospital have also been crucial. That's also a key way to control the pandemic in Wuhan. This picture is the medical workers use the Chinese medicine to treat the patient with COVID-19. So at last, I will introduce some history of China to prevent and controlling infectious disease. So in the history of China, there were no cases of amputicities caused by infectious disease. Low large-scale emigration of population or sharp population decline. From the Western Han Dynasty is 202 BC to the Ming Dynasty 1644 AD. The population of China was basically between 46 million and 60 million. The total population has not been changed much by infectious disease. So in the history in China, I will briefly introduce some the method to control the disease. The first is the pre-Qin period. That's before 221 BC. At that time is almost 2,000 years ago. The people know that the strengthened physical fitness and improved ability to resist disease. The Analects records that the Confucius disciplined the Ranbo Liu was placed in a separate hut due to leprosy. Confucius also went to visit and reach out to the great Bo Liu from the window. It is mean that 2,000 years ago, Chinese people knew how to isolate the patient with infectious disease. And the second period is the Qing and Han dynasty, just from the 221 BC to 220 AD. In the second year of the Yuan dynasty of the Western Han dynasty, the Emperor Liu Ping of the Han dynasty issued an edict that the government arranged house as isolation place for the treatment of plague patients. This is the first public temporary isolation hospital recorded in China. And in Hansu records that drought and locust plague occurred in 2 AD, and the epidemic was prevalent. The government arranged the houses as isolation and treatment sites. In 162 AD, there was a pandemic in the army. The government set up a special military infectious hospital to temporarily house epidemic patients. During the 7 epidemics in the Han Dynasty, the central government sent armies to inspect the epidemic situation and provide the medicine. And in the Qing and Han Dynasty, there were records of artificial lakes and drinking ponds, which also keep sick animals and livestock away from water sources. At that time, sewers had been built in the cities, most of which were connected by community pipes, which could discharge domestic sewage smoothly. In the city, the government also stimulate special disposal location and method for garbage, and offenders will be punished heavily. The cities of the Western Han Dynasty already have public toilets. There were special sprinkler in the late Eastern Han Dynasty. There's some pictures from that from the ancient China, and show the pipe of the since the Qing and Han Dynasty, and it's widely used in medical practice. It is one of the most influential classical medical books in the history of China, in Chinese medicine, and is also the first masterpiece of clinical therapeutics in China. It's the written by the Zhang Zhongjing. It's a Shanhan Zhabing Lun. Yeah, that's the first masterpiece in Chinese medicine. And the third period is the Sixth Dynasty period. It's about 220 to 581 AD. In 443 AD, the Southern Dynasty Song State in southern China founded the first official medical school in history. At the same time, the similar institutions appeared in the Northern Wei Dynasty in the north. So it means that about more than 1,500 years ago, the medical school was built up in ancient China. And ancient medical doctor named Ge Hong published the handbook of prescription for emergencies. This book was completed in the 3rd to 4th century AD and contain a word of earliest requirement of smallpox. And the description is very precise. The book also recommend the TB, the Gumsy disease, scabies, and rabies. The book extensively collected folk prescription and personally experience. The experience of Qinghao Jews in treating malaria provided the inspiration of the inventor of the antiminimum. The Qinghao Jews is can be isolated from this invention was will be prized by the Nobel Prize in 2015 by Tu Youyou. And the fourth period is Sui Tang Song Dynasty from 581 AD to 1279 AD. Tang Dynasty set up the emperor responsible for the management of medical schools. During the Song Dynasty, medicine developed relatively rapidly. The central government established many medical institutions, such as the Imperial Medical Bureau, the Pharmacy Bureau, the Prescription Bureau, and the Huimin Bureau. During the epidemic outbreak, these institutions were dispatched by the government to carry out epidemic prevention and distribution of the medicines. And the last period is in ancient China is Ming and Qing dynasty. Is the year is from the 1368 to 1912 AD. The Chinese human pox vaccination method has been popular since at least the 16th century. Thanks to the invention, improvement, and use of the human pox vaccination method, the epidemic of smallpox has been effectively controlled. That picture is the use of the human pox vaccination method. And as an important academic school in the history of Chinese medicine, epidemic febrile disease school has perfected the basic theory of Chinese medicine. At the same time, it has also initially established the epidemiology of Chinese medicine and made outstanding contributions to the development of Chinese medicine. That's the four the famous medical doctors in Qing hospital in Qing dynasty to treat the infectious disease and febrile disease. So that's my introduction of the experience in fighting the pandemic of COVID-19 in Wuhan. Thank you for your attention.
Thank you, Dr. Zhao. Let's have a quick 1 to 2 minute break, and then guests an audience, if you have questions, please feel free to send them to me, and I will present those questions when Dr. Zhao comes back. And I've already received some questions, so please feel free to send the questions over my way. And Dr. Zhao, we'll just have a quick break, like 1 to 2 minutes.
Okay.
Yeah.
Okay. Okay. Thank you.
Yeah, there are some really great questions. Again, sorry about the technical challenges. It was a little bumpy, but I'm glad that we persisted nevertheless. We'll give it 1 more minute. Thank you all for the questions. There are some really great questions. And Dr. Zhang has told me that if we can go through more questions, if audience would like to stay a little longer, he's happy to answer more questions. Dr. Zhang, are you still around? Are you back?
Yeah, I'm
okay.
Online.
Okay, let me first, so I have a few questions and I'll just read a question to you and then you can answer them. So the first question is from Amon about the traditional Chinese medicine. They want to know how do the healthcare, how do hospital find out, how the traditional Chinese medicine help with COVID-19? How do the medical system go about determining that the medicine is helpful to combat COVID-19?
In the pandemic of COVID-19 in Wuhan, all hospitals used modern medications and treatment, and combined with the traditional Chinese medicine to treat the patients with most all the patient. In my medical team, I use the traditional Chinese medicine more than 95% of the patient. And in my observation, the Chinese medicine is very effective for relieve the symptoms of the COVID-19.
Thank you. Just a quick follow-up on that question. Can patients opt out of treatment from Chinese medicine? Can they choose not to receive Chinese medicine?
Sorry?
So can patients choose to not to receive, traditional Chinese medicine as part of the treatment program? Can they do that?
Yeah, the patient can choose, but the prescription is made by the physicians. So the doctors prescribe the traditional Chinese medicine by the patient situation. So that's about several different prescriptions for the Chinese herbal medicine. So in different situation of the COVID-19, the doctors will give the different medications for the patient.
Thank you. That was really helpful. So the next question is, the person was wondering if there was a resurgence of the virus similar to what has happened to many of the states in the US during the fall season. So right now in the United States, we've been experiencing some resurgence. We have more cases now. So they were wondering if there's a similar case in Wuhan.
By now, there's no newly confirmed cases in Wuhan. So at these days, after the Wuhan reopening, Wuhan is very safe, and the citizens and residents is lived like the normal days before the pandemic.
Thank you. The next question we have is, how did Wuhan manage school reopenings?
The most schools have been reopened. So including the primary school, high school, middle school, and university and colleges. It's to strengthen the prevention method according to the government guideline, and reopened just formally reopened from the September this semester, September to today is about 2 months. I think the prevention method is very effective, and no students was confirmed. But so I think the guideline just you can see you can search at the internet. I can see that the prevention guidelines is effective.
Thank you. Great. So the next question is, we hear a lot about the importance of contact tracing. Could you please kind of comment on the Chinese experience in that regard? How does China do contact tracing during the pandemic?
In these times, there is some report at the some area, and just in China, we will immediately control the contact persons, and so I think just is very very effective to for the controlling, and I think if area was from has some so patient report, so the government will take quarantine and suggestions for the resident to stay or just strengthen the monitoring of the contact patient the persons.
Great. The next person is basically asking for some recommendation on how to cope with the pandemic on a personal level, because many of us have to stay at home and study online. Life is going to be very boring and it gives us a lot of pressure. And also we don't get to exercise our physical body a lot. Do you have any suggestions to people who are kind of suffer from some just mental pressure during the pandemic? How do we cope with that, and how do we support our health?
I think in China it's very safe, and I know in some countries there is still the pandemic of the COVID-19. So I have some suggestions is to just reference the guideline of WHO disease, and some official website, for example, the WHO or the CDC, or some formal health website can afford the some important and useful information about how to prevent the COVID-19. And I think this, although the COVID-19 is in fact effective, but we need to strengthen the physical prevention, but we don't have anxiety about the disease. If we can, if we have enough physical prevention, I think the COVID-19 is not very fearful for us.
Thank you. Yeah, that was really helpful. So I just have two more questions. So the first one, they're from two people that are they're similar. They're asking about what is your reaction to how the United States respond to the COVID-19? And what do you think the US can learn from China in handling the pandemic?
I think the communication is very important, and the information can be searched and found in the internet. So as I just introduced, the quarantine is very important, and in China experience is the isolation of the four categories of the patient or close contact is a key way to control the source of the infection. And in China, the treatment is also including the modern medicine and traditional Chinese medicine. And I think in the future, maybe the vaccine will be effective for the persons to prevent infected. I think it is by now. I think the decrease the social contact and especially the physical contact is very important.
Great, thank you. And the last question is about vaccine. What is can you just give us a general comment on, how hopeful we can be of the vaccine? What is its developmental phase? I think people are just trying to understand what we can, how we should expect the vaccine can help and when.
In the scientifically, the vaccine is on the way. So I think maybe the vaccine will be effective, but just is a scientific is a scientific question. So the vaccine will be tested by the use of the patient and persons, and maybe the effective rate will be tested for some years. So, but I think the vaccine I think is ultimately the method to control the infectious disease.
Thank you. So those are all the questions. Thank you guys for raising these very thoughtful questions. Thank you everyone for joining us tonight. I'm sorry that we had a little bit of technical difficulties, but we nevertheless persisted, and thank you for sticking with us. That was a wonderful talk given by Dr. Zhao. We really greatly appreciate the expertise that Dr. Zhao brought to our audience. We're also very thankful for the countless medical staff and the public health personnel in the world that are tirelessly combating coronavirus and safeguarding our health. Our next talk in the series is focused on India. I'm going to post that in the chat for people who are interested in COVID-related talk in general. This is organized by the Asian Center and the Hinckley Institute at the University of Utah. With that said, this will be the end of the presentation. Thanks again for joining us. Have a good evening.